Carly and I'm reporting for 215 LPN to RN. It is January 31st, 2025, and it's 6:30 p.m. So I'm going to go into the room. I'm doing a central dressing line change. I'm going to introduce myself. My name is Kylie. We're going to be changing your central line dressing. Let me wash my hands. So I'm going to put my hand sanitizer on, put my gloves on, and then I'm going to get everything that I need. So I have my sterile field, my sterile dressing kit. I have masks. I have extra prep stuff. And then I'm going to explain the procedure to the patient so he understands, ask him if he has any questions. And I'd just like to state right now that I have no fluids running and my lines are both clamped. Everything's intact. At this point, I just kind of like to look inside the dressing, make sure everything looks okay, and then kind of feel to make sure he doesn't have any crazy amounts of pain. Since we're now going to open up the dressing, I want to put a mask on myself, have him put a mask on, and have him turn his head so that in case he coughs or anything, he doesn't get anything on it. So we're going to take his dressing off. You're going to kind of hold the central line and pull from this way out towards the line to ensure that you're not pulling on that line. You're going to toss that, and you're also going to take the stabilizer off and get rid of that. And then I just like to look at it, state that there is a suture, everything looks good, there's no redness, swelling, no leakage. So what we're going to do from here is we're going to take off these gloves. And again, wash your hands. And then I'm going to open up my sterile field. So you can touch the outside anywhere you want. I open it away, and away, and away, and away, and kind of turn it. You can touch 1 inch around, but I try not to. And then I'm going to grab my gloves. I'm going to take my new dressing and toss it in there because it will be sterile. And we're going to put on our gloves. I always start with my dominant hand, it's easier. So once your gloves are on, toss it. I'm trying to get the air out of mine. And then I'm going to move my stuff over. I do want to say that I did raise the head of the bed and I lifted the bed and put the bed rail down before I started anything just so that I didn't hurt my back. I am going to move everything around. I have the normal saline flush and the heparin flush here. I have an extra normal saline flush and heparin flush over there because we are going to flush the lines and change the lumens. I have my lumens. I'm going to toss that because we don't need it. Organize all my cleaning supplies. I have an antimicrobial pad and then I have a stabilizing pad as well. So you're going to clean it first. You're going to open this up. There's 3 antimicrobial swabs in here and you're going to clean from the inside out, toss, and you're going to do it 3 times. Inside out, toss, inside out, toss it all. Then we're going to take our chlorhexidine, snap it, shake it, and we're going to scrub it for 30 seconds at least. And most rooms have like a scrub the hub kind of thing going on their clock, so you can watch the clock. So after you do that, you want to let it dry to air. Do not wave, do not blow on it, just let it dry. Then we're going to take our antimicrobial pad and put that underneath so that it's around the line. And I'm going to take my skin prep and put that in around the line, and then we'll put our stabilizer in. And I just like to check on the patient, make sure he's doing okay while we're doing all this. He says he's doing well, so then we're going to take the dressing, take the back off. I'm going to pull it and push in the middle so that we put the middle down first and then apply. And we're going to take our wraparound out. And we can toss it, just keep it there because it has a sticker on it so that we can write on it then. So from here, I am going to, now that my dressing is on, I do want to state that there was a suture and everything looked good. It was not swollen, or didn't look infected or anything, and the suture was in place. So I'm going to measure my line down and make sure that it hasn't moved after everything that we did. And we're going to change the lumens. So I'm going to take this lumen off and use an antimicrobial pad to scrub it for 30 seconds. And take the new the new lumen and put it on. And then we're going to do the same for the other one. So you're going to take the old lumen off, take the antimicrobial pad and scrub for 30 seconds and put the new lumen on. As I said before, both lines are clamped, so we don't have to worry about anything. And then we're going to flush both of our lines. So I'm going to take an alcohol pad, open it up. I'm going to scrub that new lumen for 30 seconds and let it air dry. As I do that, I will prep my normal saline. So I'll open it a little and push the water, the normal saline out to get the air bubble out. So once that's dry, we're going to uncap, hook this up. We're going to pull back to make sure that we get some blood return. And then we're going to push the normal saline over a minute. So I like to do 1 ml every 10 seconds to ensure that it's a minute. And once we're done with that, we will empty one aside, take another alcohol prep pad on the same line. After we have clamped it, of course, scrub, take your heparin. You're going to prep that as well to make sure there's no bubble. And then you're going to hook your heparin up and you're going to push that over. I like to try to do a minute. So 1 ml every 20 seconds because there's usually 5 mLs in your heparin. Get rid of that one. Now we're going to do the other one. We're going to make sure we clamp the first one that we did. Scrub this one. And while it's drying, grab the new normal saline that we have, prep that. Once it's dry, we'll hook it up, pull back to make sure that there's blood return, and then push over a minute. Unhook that, take another alcohol pad, scrub, and let that dry. Grab your heparin, hook your heparin up, push that over a minute, make sure that you prep it again so that there's no air in it, because anytime you get air in the line, you could cause an air embolism and you don't want that. And you're gonna push that over a minute. Once you're done, make sure you clamp that line as well so that it's both lines are clamped. What I'd like to do then is just recheck that my lines are clamped, my dressing is on. I need to put my initials, date, and the time that I changed it so that everybody knows, because every hospital has a different policy. I'll put it right on my dressing, and then I'm going to clean everything up. I'm going to check with the patient to make sure that he doesn't have any pain after what we did, so that we can give him pain medicine if needed. We'll throw everything out. So everything's thrown out. And we'll move my thing over, and we're going to put the head of the bed down. We're going to lower his bed just to make sure that he's safe, and I'm going to make sure that I put that bed rail up again. I just like to check on him one more time, ask if he has any questions for what we did, and if he needs anything at the moment. Now that everything's cleaned up, we can leave the room and go document everything that we did, including the line measurement.